as well, it must be said. Minister, in August, just a couple of weeks ago, a patient was on the back of an ambulance for over 13 hours. A verified story that you yourself will be well aware of because you attended the hospital on that given week. Minister, there has been an audit done in relation to safe staffing. Now, I've researched this audit. My understanding from speaking to SailJA and the management group that this could provide an additional 30 nurses that are desperately needed for the hospital in Mayo. But it must be sanctioned. It has to be sanctioned. The audit is there. It's sitting in the HSE. And I'm asking you, Minister, and I'm pleading on behalf of all of the doctors, the nurses who are worked off their feet, who are working under incredibly difficult situations, who are experiencing burnout on a daily basis. I'm asking for you to please implement the safe staffing framework as quickly as possible.
Let's discuss Mayo Hospital. The first thing is in relation to staffing. Mayo Hospital has had a 30% increase over the last 5 years. When I saw some of these figures, I did an analysis of a sample of 9 Model 3 hospitals, and Mayo Hospital has the second highest rate of staffing of those Model 3 hospitals. What the difficulty with Mayo Hospital is not the level of staffing. I've also included a maternity leave analysis, a sick leave analysis. Mayo Hospital is not understaffed. What Mayo Hospital is imbalanced, and I'll give you 2 examples of that. I was there on an unscheduled visit where there were 47 patients in the emergency department. 20 of them had been admitted for beds, but there was no discharging going on up the hospital. Last weekend, Mayo University Hospital, which has remained red all through August, which is completely unacceptable. Last weekend, there was not sufficient work being done to discharge during the weekend. There were 16 discharges in Mayo University Hospital on Saturday. There was 1 on Sunday, and there was 47 on Monday. Now, you explain that to me. There's not a single person in this room that can explain that, except that there is an imbalance in staffing. I was there on a Saturday, a random Saturday in August. The emergency department was absolutely overwhelmed. There was a serious patient safety issue there. The rest of the hospital was completely empty. There was practically no diagnostics going on. There weren't even people in the diagnostics area. The hospital is not understaffed, but it has an understaffing area in the emergency department, specifically because it is not being correctly staffed on the other side. I asked Bernard Gloucester for an analysis of this. I have the data back. It is my intention this week to write to every TD and councillor in Mayo to specifically outline exactly what the staffing issues are, exactly what the patient flow issues are, which are a whole of hospital responsibility, and what we need to do within Mayo to make this better. But it is not specifically, let us not confuse ourselves, this is not a staffing issue in Mayo Hospital. It has one of the best staffing ratios of all of the Model 3 hospitals. What's not happening is that's not translating from a patient flow perspective into making sure that the patients are safe and that the staff in the emergency department are appropriately supported to make sure that they can do their jobs in the way that they need to do it. So we're going to stick with the facts here. It is not understaffed. It needs to be balanced.